Why would you want to add massage therapy to your practice? What's the point? It's a collaborative treatment to augment chiropractic. What we do, we're dealing with the musculoskeletal system. So if we can have somebody who addresses those muscles and helps address the joints and stretching and loosening tissue up, it's a great tool to use for marketing. I've helped use it to help build my practice.
Hi, everybody. Welcome in. If this is your first time here at our master class, my name is Angie. I'm a senior advisor here at Proactive Marketing. And then every Thursday, we host all of our master classes with the one and only Dr. Layton. How's your day going so far?
It's going amazing. How about yours?
Beautiful. Beautiful. Thank you. So today's going to be a pretty interesting topic. If you are a chiropractor looking to incorporate extra modalities, extra care for your patients just to get them back to that journey of being healthy, we are going to be talking about how to incorporate massage therapy into your chiropractic office with that chiropractic care. So if you are interested in learning a little bit more, definitely grab a pen and a paper. We'll be going through a lot of new and different information. So without further ado, Dr. Layton, go ahead.
All right. Incorporated massage therapy with chiropractic care. I've been in practice since 2000. I've had chiropractic care incorporated with massage therapy since 2002. So just over 20 years that I've had massage therapy offered with the chiropractic care that we do. So massage is the most integrated service in chiropractic care. Why would you want to add massage therapy to your practice? What's the point? It's an added service that most people love, so it helps get them in the door. 10% of the population is using chiropractic. 90% of the population loves a massage. You tell me. If it helps get people in the door, why not? Additional revenue. It's not like you're going to give it away for free. It helps improve patient outcomes, patient recovery. So accelerate that recovery process. It helps with patient acquisition and retention. So if you want to get patients in the door and you can help use massage as an alluring item, and if you want to help keep them in the office using massage, it helps. A lot of doctors like to do soft tissue work. There are some doctors that don't. So if you're doing it and you want to free up time to have more time for patients, or you don't enjoy doing the hands-on yourself and you want somebody else to do it for you, massage therapist, being in the office, that's a good way to take care of that. It's a collaborative treatment to augment chiropractic. What we do, we're dealing with the musculoskeletal system. So if we can have somebody who addresses those muscles and helps address the joints and stretching and loosening tissue up, helping with the rehab, it helps. It's a great tool to use for marketing. I've helped use it to help build my practice. So whether we're in schools, during Teacher Appreciation Week, we'll reach out to the schools, whether we, do a call, send a letter, do both, follow it up. But they'll typically have us in like the teacher's lounge. And so other teachers see you and you bring a couple massage therapists. You're doing chair massage, doing like 10 to 15 minute massages per person. And you set up a schedule for X number of people. But it's a good exposure, and maybe you can get in multiple schools throughout the school year doing that. Golf outings, so like the FOP, so Fraternal Order of Police golf outings. We've done other golf outings. Taking the staff out, we sponsor a hole, take a couple of massage therapists out. The golfers love it, get them loosened up, good swing. Local runs, so Team World Vision is a big running group here that helps. They run to get clean water for families in Africa. So we've been affiliated with Team World Vision and working with their runners. Other charitable events that we've gone out to, local businesses. So like we've been to some of the local stores, some of the other schools, the preschools, where they'll invite us out and we bring the massage therapists, and it's a feel good. And so it's a good way to help break down the barriers and get your chiropractic. So the massage therapist helps establish rapport with the patients, develop those relationships, and they get to know the patient and get to know them. So vice versa, it goes back and forth. So they develop a relationship. I've had one massage therapist that I've worked with for about 14 years now. So she's been an outstanding employee. And I have two other massage therapists that haven't been with me quite as long. One was a patient first. She's probably been a patient for 13 years, and doing what she did in the office, or experiencing what she experienced in the office, motivated her to want to become a massage therapist. And then eventually I brought her on staff. But anyway, it helps with patient recovery and long-term retention of those patients. Then you can also help your massage therapist with the technique. So using their body weight leverage, flow, stretching to avoid burnout and injuries. So, spa type massage where we think of like kneading and like, rubbing muscles and using a lot of hands and things like that. If you're trying to do deep tissue massage with your patients, if you're doing heavier work, sports massage, it doesn't necessarily work for your therapist to be able to last a long time. They're going to get burned out. They get tendonitis. So whether they're injuring their wrists or injured, getting tendonitis in the elbow, you can do things to help them use body weight, use the lotions, creams, things like that, where they can kind of glide and use more forearm, elbow, and not beat themselves up, and they can have a long career and still give your patients really good work and deep work that they like without having to beat their hands up to. So what you should expect from a massage therapist: understanding the anatomy. So whenever we interview a massage therapist, obviously they have to make it through the face-to-face interview. But after that, we'll ask them to come back and do a practical interview. And so where they're going to come in and work on whether it's me or one of the staff members. And normally, within 5 minutes, they're either this is somebody who's really good or they're not. It doesn't have to be someone who's had a lot of experience. It's, do they have the right amount of touch? Can they take direction? I'll normally tell them, to work certain muscles. So I want to know what their knowledge is of anatomy. So I may tell them, work SCMs, scalenes, and upper trap. And so if they can't figure out where the scalenes and SCM are, they're probably not going to make it in my office. So there's certain areas that they should be able to pick up on when I tell them to work whatever anatomy. Again, the pressure should be right. The speed should be right. And you can kind of guide them to slow them down, speed them up. Maybe they're nervous. So massage therapists, you want to keep them on track, especially if you're having them on a schedule in your office. So, if they're on a 30-minute, a new patient coming on the table every 30 minutes, so they need to allow the patient a couple minutes on the front end to change, to expose whatever region it is they're getting worked on, and a couple minutes on the back end. So what's normally a 30-minute scheduled massage is probably about 25, 26 minutes actually on the table. And so making sure your therapist stays on track, because if they start to fall behind, it affects everybody else's schedule the rest of the way down for the day. It can affect them, then the patient coming off that table onto your table and throw your flow off. Your massage therapist should, get mutual respect from you as a healthcare professional. So it goes both ways. We should respect them. We had a doctor that used to work with us that he talked down to all the therapists. He felt like he was above them because he was the doctor, and he spoke to them that way. And you could see that the amount of respect or lack of respect that he got then back from the therapist because of that, eventually kind of worked his way out the door, because he had nobody to back him, support him when patients asked about his care. They didn't have a lot of good things to say, because he didn't have a lot of good things to say about them. And again, we had excellent massage therapists working for us. So it should be hand in hand supporting each other. So you want massage therapists to have interest in a clinical setting. So, massage therapists sometimes get tired of that spa setting, salon setting, where they don't see, the patient repeatedly. So maybe they've worked on whatever area, but they don't know what the outcome was. Maybe they helped them that day, when the patient was getting off the table, but they don't know what they were like a day later, a week later, a month later. So that continuity in care. And so that's what, being in a chiropractic office helps provide, is that continuity in care, that they get to see the follow-up of the patient, get to see the progress, that willingness to understand conditions and treatment protocols. So, if you're explaining, this is a hot low back, and so you should have a bolster under the hips. These are the muscles I want you to work. This is why I want you to work this muscle. And that you may see it differently than they do, but working with them to understand why maybe you want it done your way, but then maybe they explain their way, and you're like, okay, I see your point of view, and you can do your thing. Again, a lot of the massage therapists are looking for that continuity. They want that follow-up. They want to build that relationship and see patient progress. Again, they should be charting or doing soap notes, some form of documentation if they're going to be in your clinic. And they should be promoting chiropractic. They should be promoting what you're there for. You want somebody who's a team player. We've had massage therapists that they didn't play well with the rest, and again, they kind of worked their way out. They're phenomenal massage therapist in a one-on-one setting, but when you have a practice with a lot of staff, a lot of massage therapists, and you have somebody who can't get along with everybody else, it kind of ruins that dynamic, and they need to move on. So at one point, we had 5 massage therapists on in a day, keeping everybody busy. Again, you want that nice dynamic, nice flow. You want good energy in the office. So you don't want somebody who's kind of the fly in the ointment. Again, that willingness to learn, they may come in and they know low back pain, but they don't necessarily know all the muscles that you would want them to work that are associated with low back pain or chronic disc or whatever it is that you want them to understand. So why they should or should not work on an area or how they should work. You want your therapist to have a diverse skill set. Most people coming into our office are not wanting a lighter massage. They don't want Swedish. They don't want just, a rub it up. They don't want something light. They want therapeutic, deep sports massage, trigger point. They want them to, lay into them with their elbow and their forearm and, feel like the elbow is going to come out the other side. They want it deep, borderline that, that hurts so good type of massage. But sometimes somebody comes in, they're really acute and they can't handle that. And that's where being able to, they should be able to understand the patient's condition, what's going on, and then okay, today's going to maybe be a little bit later. Or I'll step in if I know somebody was in some type of more acute condition. I still want them in with a therapist. Maybe I'm having them do ice massage for a period of time before they work into another form of treatment. So again, a recent grad or spa therapist may lack skill set, confidence, or communication skills. That doesn't mean they can't learn those things. I've worked with both. The spa type therapists tend to be, again, very handsy and they do a lot of kneading. And so they tend to beat themselves up. They don't tend to have as long of a career because of that. If you can get them trained where they're using their body weight to leverage, doing that flow and, using the lotions, the creams to use their elbow and kind of work those paraspinals, things like that. They tend to have a longer career and stay healthier, avoid the injuries. Those recent grads, same thing. You teach them those same skills. You teach them how to talk to people, and the more comfortable they become because they're seeing the patients regularly, they're seeing the improvement, the easier it gets. And then again, making sure that communication with the patient tends to be focused on the patient and about their health. It doesn't need to be about their kids and stuff all the time. Some of that stuff's going to come up, irregardless. That's just kind of the nature of the beast if they're laying on a table for half. But they're going to get to know people, and so they'll build that rapport and they're going to build that skill set and ultimately they're have. So you want somebody who's a good communicator. You want somebody who talks to them about chiropractic, talks to them about stretching and hydrating and things like that. So again, promoting what you do. So you want, and somebody who's loyal. When they, show you their resume, you don't want to see that they've been at 20 different places. That's somebody who jumps around and they're inconsistent, and you don't want somebody who's coming in and basically trying to poach your patients. And then professional. And I don't care so much about whether they have tattoos or not, if they have piercings or not. It's can they come in and conduct themselves in a professional manner? Can they interact with the patients in a professional manner, give them the service that they need, and help get them better? So when you bring them on, what form do you bring them on in? Is it employee, an independent contractor? Do you want them to rent space from you? And so you have to kind of figure out and determine for your situation what works best. We'll start with the independent contractor because it's probably the hardest one to keep delineated that way. But they would get a 1099, they pay their own taxes. So it reduces your own tax liability, which is nice. But again, that's someone who's determining their own schedule. They fill their schedule themselves and they're providing their own tools, essentials. So, the sheets, oils, they're doing all that on their own. But somehow they're getting their own patients and then you're paying them based on what they're doing for work. An employee, you're actually paying the taxes. You have a set schedule. You provide all the patients for them. You're providing all the supplies they need. So again, you're the one providing the lotions and creams. You're the one providing the sheets they use, the table, everything else. So that, whether your office is, like we really only have massage therapists in the afternoon, except on Fridays. But, so from 2:30 to 7, we're the one filling their schedule. And so we give them the sheets, we take care of everything that they need. And then a renter, you have an extra space in your office that, you're really not utilizing. You want to be able to start making, your square footage pay for itself. And you wanted some square footage that it wasn't producing, start to produce. So you have a room that you have a massage therapist now renting space and they just pay a flat rate monthly. The nice thing about having a renter, you get to let them do their own thing. They have their freedom to do what they want, their autonomy. They get to treat the way they want. But again, maybe they're bringing some massage clients in the practice that maybe hadn't been exposed to chiropractic, and maybe they end up flipping over and doing chiropractic as well, too, coming in to see the massage therapist that they're seeing. So getting paid. For you getting paid, do you want to do it as cash or insurance? There are ways to do massage through insurance. So the CPT code 97124, that's for massage. So when your staff is verifying a patient's benefits, they can ask and see if that code is covered. So like the state of Alaska, that's a covered code. They actually, massage therapists have autonomy in the state of Alaska that they can actually build the insurance companies themselves. So they still see the value there. A lot of other states don't cover it. But that 97124 code is covered by personal injury, workers' comp, and some of the private insurances. Another way to bill for insurance is the 97140, so the manual therapy code. Just make sure you're doing your documentation properly. But if you're doing 97140, the 98940, 98941, 98943, so your adjustment codes, you can't bill for that same region as a 97140, so you need solid documentation. That documentation needs to show that the 97140, that manual therapy is done, which is separate from where you adjust. You can't bill on the same day for both those services if they're done in the same region. That's a huge red flag, and you'll have the insurance companies breathing down your neck, and they're going to want some money back. So 97140, trigger point therapy, myofascial release, manual traction. That's what comprises that 97140. So make sure that that kind of thing is in your notes if you're going to do it, and if it's documented that way in the area that they're working, then you're covered. 97124, so massage, so Poma, Petrissage, and Effleurage. So that more like cupping style, soft tissue, the stroking, kneading type. Again, that's so a little bit different than the 97140. But if you're going to build those codes, make sure you're documenting what's necessary. So whether it's the trigger points, myalgia, contractures, muscle spasm, weakness, hypertonicity, hypotonicity, those things need to be in your notes or the therapist notes for the area that they're working. Treatment times, they can vary. They're easier, usually in 15, 30, or 60-minute blocks. We do all half hours, just what works easiest for me. As long as I've been in practice, that's worked really, really well. The 30-minute block. We don't do anything longer. It allows me to get more patients into that throughout the week, but long enough on the table that the therapist can actually make a difference, see some improvement. The 15, I think, tends to be a little too short. 60 minutes, I don't want somebody with a hot low back on a table for 60 minutes anyway. 60 minutes is a little bit more spa-ish to me. And that 60 minutes, again, if I'm doing anything where it's related to insurance and billing, that 60 minutes, I'm not necessarily going to want to bill 4 units of a 97140. So again, I'm very comfortable in that 30-minute marks where I'm doing 2 units and I'm comfortable with that. So when offering it as a cash service, $25 to $35 is usually a safe number for that half hour, $50 to $65 for an hour. You're really, what you're doing is kind of looking at what your Heavenly Massage and Massage Envies are doing in your area, and you want to be a little bit competitive with them. Again, you're offering more that medical or clinical massage, and so patients shouldn't expect to necessarily be tipping the therapist when you're office. So that helps reduce what their overall cost is. That's kind of the benefit of doing in a doctor's office. So it allows you to maybe charge close to what those places are charging, but in a sense, essentiality, it's just that it's a little bit less coming to your office, and it's in a clinical setting. So you've got a doctor overseeing their massages as opposed to just going to one of those other places in their once a month program. Most massage therapists in the chiropractic office are paid somewhere in that $20 to $30 an hour range. The massage therapists that are good, if you want to keep them, you're gonna need to be in that range probably. I had a doctor though that I was friends with. I'd interviewed a massage therapist. Massage was great. And then when we got down to dollars and cents, she wanted more than I felt comfortable paying a massage therapist. She wanted to be in that $40 to $45 an hour range. At that point, you start eating into the profits. It didn't make good business sense to bring somebody on at that dollar amount. The doctor that I was friends with brought her on, and he paid her that. But essentially, it burned out because it wasn't sustainable at that dollar amount. He was losing money by having that massage therapist working because eating into the profits too much.
Hey, Dr. Layton, we actually
Yes.
had a question in the comment section from Dr. Angie.
Okay.
I think she was asking more of a, what do you call it? A more specific question in regards to her area. She's asking, what is the typical hourly rate for a massage therapist in the suburbs of Illinois as an employee?
So I have at the top end, I would say is that $30 an hour. I have three therapists. I have one at 25. I have two at 30. So that 30, anything above that, again, it's starting to get a little bit too high. When you get above that 30, that it just doesn't make sense to pay them more than that. Otherwise, there's what's left for you at the end of the day. And you've still, especially if it's an employee, you're going to have to pay taxes and everything else. You're still paying for the sheets. You're still paying for the lotion. There's a cost in all of that. But that $30 an hour is really kind of the top end.
Okay, perfect. Sounds good. And thank you so much, Angie, for asking the question. We will be reposting the question in the group for everybody else to see as well. And thank you, Dr. Layton.
You're welcome. So that massage membership program, again, this is kind of what we were talking about before with you're competing with like a Heavenly Massage, Massage Envy. You're providing a medical massage in a clinical setting. So it has a certain appeal to it that you can offer that kind of service in your office. So you can establish your own program. No different than them. You can do that 12-month membership, put it on auto pay so you know that revenue is coming in. So basically they're paying for that one massage a month or two massages a month. If you break it up into 2 30-minute sessions versus the 1 hour, whatever works for you in your practice, how you want to do that. You can give them a discount if they're adding additional family members. So maybe give them a 10% discount if they add an additional family member that's on that program. You can offer availability of gift cards if they want to buy that as a gift for somebody else. Nobody in our office goes in massage without having done an exam. So again, it introduces patients to chiropractic care that maybe otherwise wouldn't have tried chiropractic. You then in your program, you're going to need some type of opt-out notice. Say if they just decide to discontinue 6 months in or whatever it is. It's okay, let them out, but then there's a fee for that. Otherwise, you're sticking to that annual program. And then your massage therapist, the way they communicate with those patients that are on our table, they're going to help convert those massage patients over to the chiropractic. So again, it's increasing your numbers, increasing your exposure.
Awesome. Thank you so much, Dr. Layton. Definitely a lot of interesting information that was covered. I have a few questions that I wrote down myself. So, how long have you had massage therapy implemented into your practice?
So 20 years, just over 20 years. So 2002 is when I started with massage therapy, and so here it is, 2022, 20 years later, almost 20 years later, almost 21.
And I can imagine it's still lucrative for your practice, right?
It is, and something I didn't mention, but I have had better luck with female massage therapists than male massage therapists. I had one male massage therapist that decided to go back to like business, the corporate world, but female massage therapists, I've never had anybody say, I felt uncomfortable because a female was working. Where we had a male massage therapist that we tried it, and that I've been gun shy ever since. He made patients uncomfortable, made them feel like maybe he was trying to expose certain areas that he shouldn't be exposing. We cut it off real quick. He was out of the office. But you never want somebody in your practice that when you have somebody on the table, you don't want anybody to feel compromised. You don't want them to feel, we're not safe. Somebody's doing something that's inappropriate. Massage therapy it's kind of an intimate thing. Patients have a certain area and a certain amount of skin exposed, and so they're kind of vulnerable. And so you want somebody who makes them feel comfortable when they're in that situation.
Totally, I agree. With that being said, was it that only one time that you had a male massage therapist? Ever since then, you've only hired female massage therapists?
And so I had the two. So the one went back to corporate world. It was the second one that just it
didn't work out.
Yep.
Got it. Okay. And then I think you mentioned something about massage therapists not being in your practice in the afternoon, or was it the other way around?
Other way around. So Monday through Thursday, they're there, from the start of our shift, so that 2:30 till 7. And then Friday, that's otherwise I don't offer it in the mornings, just Friday mornings. We do, because we have a shorter day on Friday, 9 to 12, 2 to 4. So that's the one day that I offer massage beginning to end of the day.
Oh, got it. Okay. Okay. Is it like more of like, have you found that it's more popular in the afternoon rather than having in the morning? I can imagine something like that.
Yeah, because generally you're getting the people that are coming out of work.
Right,
So they're able to
exactly.
come home. And that's, it's been a little bit different with the pandemic because so many people have been able to start working from home that we've kind of seen where, our afternoons aren't typically as crazy, that we've seen more people kind of coming in on those mornings appointments, but I can still get them to do the rehab and stuff that I want them to do and not have to offer that massage therapy.
Got it. Got it. Beautiful. Okay. Yeah, I kind of imagine something like that, people getting off of work, coming and visit your practice, relieving some tension. I actually have 2 more questions from Dr. Angie here. So one of them, the first one is, do you have a no-show charge?
I do not.
Okay. Do you have any suggestions for somebody who is contemplating a no-show charge?
If you're I will tell you with the stuff that had come out through healthcare with the pandemic, they were really discouraging the no-show charge. But each office has to do their own thing and what they're comfortable with. If you cancel within 24 hours, a lot of my patients I've known for a long time. If something comes up, something comes up, and sometimes it's unavoidable. And so I don't feel like I have to punish them for that. If I had somebody that was a frequent abuser, at that point, we would just cut them off of massage altogether. It's the easiest way to do it. But I'm not going to punish somebody financially for it. But that's what I'm comfortable with. That's how I do it in my practice.
Mm-hmm. Yeah, I can definitely imagine, like, just coming from an aspect of business too. Maybe this is not very relatable in the chiropractic world, but I do know that some of the smaller businesses who are just starting to build up do have a no-show charge. I don't know exactly what the numbers are. Sometimes it's just like 25% of the quoted treatment or things like that, just because for the newer ones, I guess it's more that they don't have an established patient base with them. So then there has been situations where I've heard people do abuse the ability to not come up or show up, sorry. But again, just like Dr. Layton said, it is based on each practice and kind of what you would like to implement to your practice. So the next question that we have from Dr. Angie, we actually have 2 more. She's asked, what are the best hours and days to have MT in the office? I think you kind of touched briefly on that just now.
Yeah, so really pre-pandemic, it would have been those afternoon to evening hours. So, where people are kind of finishing up work. So teachers were finishing up school. If it's the high school, they were right around like 2:15, 2:30. So maybe they were rolling in about 2:45, 3 o'clock. So three to close was kind of like the prime time. And so that's, our afternoons go 2:30 to 7. So that just kind of makes sense. That's what's always worked with our practice. But with all the people that are able to work from home now, they may take their lunch and they're coming in the office at, like, say 11 o'clock and getting treated, and they go back home and go back to work. So where, it probably makes some of those morning hours a little bit more viable for being able to offer that type of service.
Okay.
I know that the afternoons are what have always worked best for us.
Yeah. And I feel like just on based on the consumer schedule, it seems like the afternoon is probably the best time to also hold a massage therapy session. And then her last question, and Angie, feel free to ask as many questions as you like. She's asking, what if the massage therapist doesn't have any massages booked that day? Do you still pay hourly for the MT?
So I've never had that situation. Which is nice, right? But if it's an employee, technically, either bring them in, or you can just tell them, hey, it's going to be a day off. But if it's a normal scheduled day, technically, yeah, you would have them in there. So is it they don't have any patients in their schedule, but you have patients in your schedule? So maybe you can move some patients over to the schedule and start filling them up, introducing patients to massage that hadn't had it before. Or if it's a practice that you're trying to get established, maybe you're working something out with a therapist that, like, hey, I'm going to try to fill you as we can, and you pay them per massage as opposed to an hourly rate. So it's kind of an hourly rate, but you basically pay them on units. So if you want to call a unit, just like how we work in units in 15-minute increments, you're paying them, per unit that they do with patients as you're getting that service established.
Okay. Yeah, that definitely makes sense. So, and I kind of think that correlates with the fact that you have your massage therapist do the soft tissue work. And then they kind of come see you for the chiropractic work, I think. So I think we can, I think also it would be good for the patients to be able to, see both of you guys. And I think it also just establishes the massage therapist to the practice if you're dealing with somebody who's new. Just get their face out there, get their hands on with more patients and things like that. And I think that would be really good. Yeah, thank you so much, Dr. Angie, for your questions. It looks like that was her last question. If there are any other questions, anybody if you're watching this, you have any questions regarding massage therapy, please drop those messages or comments down below this masterclass. We see everything. We can also post those onto the Facebook group so that everybody can also see those answers. And feel free to ask those questions as a post as well. And yeah, I think we're ready to wrap up our masterclass. Thank you, Dr. Layton, so much for hosting the masterclass. Angie says, thank you for the awesome information, doctor. You're welcome, Angie. Thank you for joining. And yeah, I think we're good to go. We'll see you guys next week.
See you next week. Angie, welcome to the team. So I know you're new to Proactive, so best of luck to you and best of luck to all the doctors.